Good evening, my name is Amanda Healy, and myself and 3 peers are doing a presentation for our Administration of Long-Term Care class at University of Michigan-Flint. This presentation is about the 2016 Centers for Medicare and Medicaid Long-Term Care Reform. I'll be introducing the subject and discussing part 1 with the problems involved. Daphne will be going into detail about the policy process. Brandy will continue by discussing regulation and policy preferences. Donnell will describe health financing and long-term care, as well as concluding our presentation. We hope you enjoy and learn something new about these changes. I'm going to start by doing a brief introduction about our presentation, and then I'm going to move right on into part 1. So for our introduction, it's a common known fact that our population continues to age, which means there's an increased need for better Medicare and Medicaid, also called CMS, guidelines. Per the reform, starting in November of 2016, a 3-phase plan was implemented to revise the requirements for long-term care facilities and their CMS funding. CMS can be dated all the way back to 1965 when it was developed to support our aging and low-income populations. Now that the 3-phase implementation has began, the legislative process needs to push through to implement these changes and ensure proper training within long-term care. Because the requirements have not been updated or changed in nearly 3 decades, the policy preferences within the government will place more items on the agenda and change the overall well-being of long-term care communities. The final area that's going to be discussed is the financial area. Whereas the reform states there will be a need for additional staff, credentialing, training, so on and so forth. All of which cause question for the funding and availability of these funds. So as we move into part 1, as most of us know, CMS is known for insurance reimbursement of the older, disabled, and low-income populations. Insurance is obtained by these individuals, but only under certain circumstances. Age, what type of income they have coming in, so on and so forth. So long-term care facilities have specific stipulations to be able to participate with CMS to receive their funds. This is where the 3 phases ranging from 2016 to 2019 take effect. According to the reform, this is to implement improvements across the board for long-term care. This will also help reduce duplicate and unneeded requirements that are currently within the CMS guidelines. But this isn't without larger issues that are going on. CMS already has a low reimbursement rate, so the funding for the added training programs, so on and so forth, will cause burdens on many facilities. This is in hopes of not taking the time and funding away from the residents. The problem that we need to advocate for is better reimbursement over the phasing of the reform. This will help to ensure that facilities and residents who reside in them have proper care. So we need to take aggressive action. Must be taken. It really must be taken to change the overall thinking and to ensure that the 2016 reform for long-term care is pushed through to increase reimbursement rates, to create a positive future, proper training, and better overall resident care for our facilities. Thank you.
My name is Daphne McClellan. This is part 2 of the CMS Long-Term Healthcare Reform Bill. The bill needs to go through several steps before it becomes implemented as a law, and these steps include assignment of a prospective number, and once that bill is given an appropriate number, the senators or representatives that are sponsoring the long-term healthcare bill can sponsor the bill, introduce it to the committee or the subcommittee, whichever best suits the bill in question. These areas make debates and decision about the verbiage and content of the long-term requirements. They process newly introduced ideas for the LTC bill and research any new legislative needs that might have come up. The subcommittees also conduct reviews and hearings to hear support and testimonies for the bill. After the completion of the hearings, the subcommittees hold sessions to revise the bills, make any necessary changes before presenting a revised version of the LTC bill to the full committee. Full committee receives the report, may conduct the same process as the subcommittees, performing additional hearings and investigations before voting to send the bill to the House or Senate. The committee may accept the bill as originally submitted or with any amendments. After the legislators debate the bill on the floor, the subject is put to a vote, and once the chamber passes a vote, the bill is sent to the other for approval. If both Senate and House pass the bill and any amendments, it goes before the president for his review. After the president signs the legislation, it becomes law. The next phase moves to implementation of the long-term health care issues. The final rule will revise the requirements that long-term care facilities must meet to participate in the Medicare/Medicaid programs. These necessary changes reflect the substantial advances that have been made over the past several years, and in theory and practice of several delivery and safety. These revisions are also an integral part of our efforts to achieve broad-based improvements both in the quality of health care furnished through federal programs and in patient safety, while at the same time reducing burdens on the providers. All of these updates are from the CMS Federal Registry as they continue to update this plan. Why we use federal agency regulation rather than legislation from Congress is because regulatory agencies are empowered to create and enforce rules, regulations that carry the full force of the law. Congress passes laws that govern the United States, but Congress also has authorized other federal agencies to help put those laws into effect by creating and enforcing regulation agencies. They get their authority to issue regulations from laws or statutes enacted by Congress. In some cases, the president may delegate existing authority to an agency, but typically when Congress passes a law to create an agency, it grants that agency general authority to regulate certain activities within our society. Agencies must not take any action that goes beyond its statutory authority or violates the Constitution. An agency must follow an open public process that when they issue regulations according to the Administrative Procedure Act, the APA, this includes publishing statements of rulemaking authority in the Federal Register for all proposed and final rules. One of the most important parts of our rulemaking process is the ability of our public to participate. Public feedback on federal regulations is necessary if we are to fully embrace our values. The most important of these public participation mechanisms is the ability to comment on a proposed rule through what is commonly referred to as our notice and comment period in an informal rulemaking. Once the agency has read and considered all comments, it decides whether to go ahead with a final rule. The agency might adopt a final rule identical or very similar to the initial proposal, or it might make changes based on the comments, might even decide to stop the rulemaking altogether. This process can take months, it can take years. Then it's published in the Federal Register, where the government gives people notice of any new developments. Some of the public comments that were made in the Medicare/Medicaid reform were strengthening the rights of long-term care facility residents, ensuring that facility members were properly changed, preventing elder abuse, ensuring that staff members have the right skills and competency to provide personal care to these residents. Medicare's long-term debt is in the trillions. It's funded by a workforce that is shrinking. We're looking for an agenda to improve health care, not just to manage its costs.
Hello, my name is Brandy, and this is part 3 of the 2016 Reform of Requirements for Long-Term Care Facilities paper. Part 3 of this paper focuses on interest groups and political action committees and the roles that they played in this reform. Just a little background on what exactly an interest group is and what they do is an interest group is a group of people that seek to influence public policy based on a common concern. One of the interest groups that played one of the largest roles in this particular reform was the American Healthcare Association, also known as the AGE368. The American Healthcare Association often works with Congress and federal government to advocate for long-term care facilities and has played a major influence in the reform of requirements for long-term care. The AHCA was responsible for launching the massive grassroots campaign that allowed for thousands of comments letters to be sent in to the CMS in regards to the reform of requirements for long-term care. Two major provisions that these interest groups inspired that we can see reflected in the new requirements for long-term care facilities was the ban on forced arbitration along with the more regulated requirements for long-term care facilities. Forced arbitration basically deprives nursing home residents and other long-term care facility patients of their ability to sue or prosecute a facility in the event of abuse or neglect. This is due to a binding contract that the facility has their patients sign in order to be admitted into their facility. U.S. Representative Hank Johnson, along with 26 other members of Congress, played a huge role in the ban of forced arbitration in nursing homes specifically. Johnson, along with many other organizations like the AHCA and the ANA, wrote letters to Andrew Salvet. Now, Andrew Salvet at the time was the acting administrator for the Centers of Medicare and Medicaid programs. In these letters, Johnson, along with the other advocacy groups, expressed their concerns with nursing home patients' health and safety. And in response to these letters, along with many other active concerns, the CMS issued the revised reform of requirements for long-term care facilities. However, due to the new proposed health care by the Trump administration, the ban on forced arbitration may never take place. Another major provision that we can see reflected in the new requirements was the issue of staffing. The interest group that played the largest role in this by far was the American Nurses Association. Because a huge majority of nursing home incidences and accidents occur due to a lack of trained professional staff, the ANA was happy to see that the CMS recognized that the current requirements for long-term care staffing needed to be updated and revised. A political action committee, also known as a PAC, is any organization that privately raises money to help influence political elections or policies. Most PACs in the healthcare sector tend to be nonpartisan, meaning they donate to both the Democratic and Republican parties. In the 2016 election cycle, it was reported by the Federal Election Commission that out of the 367 healthcare PACs, around $55 million was donated to both parties, with 60% going to the Republican Party and 40% going to the Democratic Party. However, in regards to healthcare professionals specifically, meaning doctors, nurses, and other healthcare practitioners, around $23 million was donated, with 60% going to the Democrats and 40% going to Republicans. So what does this mean in terms of the reform of requirements for long-term care? Well, the reform of requirements for long-term care was created under a Democratic administration. And because the Democrats tend to support government intervention, while most Republicans tend to oppose it, we can see how some of the requirements that the reforms set in place have already been reversed by the current Republican administration. For example, the ban on forced arbitration. It is for reasons like this that Congress needs to come together to help create a more efficient system for all Americans. This has been part 3. Thank you for watching.
Hello everyone, my name is Donnell Fisher, and I will be presenting to you Part 4 of my group's 2016 CMS Reform presentation. Reimbursement, resource use, monitoring, quality mechanisms, and ethical and legal problems are all issues connected to our topic because each one is addressed in the CMS reform and intertwined with one another. Upon being admitted and discharged from the hospital, Medicare distributes money to the hospital based on specific criteria for what treatments and services were provided for that resident. The same process is similar for long-term care facilities and being paid to care for residents. Many Many resources are provided to allow obtainable patient-centered care for residents. These sources include nurses, physicians, pharmaceutical services, diagnostics, and dietary plans. These resources provided are essential in the well-being of residents and their legal rights while residing in long-term care facilities. Monitoring the new reform over the next year is projected to have a decrease in the amount of money spent on care and to try and combat the progressive increase of goods and services that will be provided for the aging population in years to come. Quality of life, quality of care, freedom from abuse and neglect, and person-centered care plans are all quality mechanisms mandatory for the safety of residents. These qualities also ensure legally that residents are being treated with respect, care, and autonomy. There could be many things ethically and legally done wrong in long-term care facilities. So to improve this aspect of the business, ethical compliance programs are put in place to educate staff and other caregivers on residents' rights. This includes keeping up to date with patient plans of care and updating them as needed to promote better health. Our topic is also related to other topics such as population health, health financing, and the long-tail theory. Population health is a broad term to use and apply to a specific topic relating to a group of people because of the large scale at which it is referred. There are many determinants that affect the health of those who stay within long-term care facilities that range from environmental, social, mental, and physical factors. This reform has taken into account these types of groups, past interventions, and new statistical outcomes to help improve the overall health of those that reside in long-term care facilities. By setting new standards, rules, and regulations, they are able to decrease the amount of spending residents use for Medicare and Medicaid. They do this by reviewing cases and the profiles of the residents with their guardians and appropriate attendance to determine if a medication needs to be discontinued, a new exercise should be used, or if a diet should be incorporated. Health financing is an important part of concerning Medicare and Medicaid costs. Because of the aging population increases, so does the eligibility for Medicaid and Medicare. This means more money spent on the cost of living, care, medications, treatments, therapies, and personal needs. The new reform has included some steps to help preserve the cost of care and help reduce the estimated costs of incoming years. Holding skilled nursing facilities and nursing facilities responsible for the care and safety of residents' essential items, such as dentures, breathing machines, and other items needed for daily aid. CMS can decrease the likelihood of damage occurring to those items so that they last longer. Reducing unnecessary and avoidable hospitalizations can also greatly reduce costs. This new reform requires long-term care facilities to include a discharge planning focus that creates a plan of service that will ensure the safety and participation to aftercare by the resident and care providers is properly met to prevent reoccurrence and readmission to the hospital. The way the long-term theory connects with our topic is that it represents the way in which medical health care is essentially provided and the types of care that is being offered to residents. The long-term theory, in short, explains that in the beginning of production, a product may be popular, but after a while, the product value soon starts to decline, making it hard to keep on the shelves in store because it's not catching the eye of the consumers. Sales also of companies are plotted along a graph, the beginning being the bulky, most popular items, while the end of the graph stretches out like a long tail, showcasing other products the company sells that aren't selling as much. By researching and understanding what services that are provided to long-term care facilities, the reform provided is projected to having a better impact on residents and those who provide care for them. These new regulations are capsizing the most effective way in providing them with quality life progressive resources. By focusing on the services that have been provided for many years and being selective on what is being provided to the residents, implementations have been made that yield results in long-term care facilities. The Centers of Medicare and Medicaid have come with new regulations to help improve quality of life for better and omitted other regulations that may have not been shown to boost quality of life or may have seemed repetitive of other segments.